Hi, everybody. Welcome to the webinar. We're just waiting for people to join. We can see you joining. The chat is not enabled today, but you can, if you rename yourself and your organization, which you can do, and you can ask questions then in the Q&A as well. And we'll be starting at 1 o'clock on the dot. You just, if you want to change your title, if you go up to the top right-hand bit of your screen where you can see yourself, click on the three dots, and it'll give you an option to rename yourself there. So maybe not everybody might have that option on their mobile, but that's okay too. Okay, we're gonna start. So welcome to everybody, and welcome to Environmenstrual Week of Action 23. I don't know if everybody knows or heard about when. The Women's Environmental Network, we have been campaigning on issues around menstruation since our inception in 1989. And we work on issues generally linking gender, health, equity, and our environment, such as climate change, through our Feminist Green New Deal work. We have local food growing work, especially in Tower Hamlets in London and in our London borough. And we also work on calling for safer chemicals legislation and health and safety policy to protect current and future generations. I'd like to say many thanks to NaturCare for funding this event through their 1% for the Planet scheme, and for their continual support of our work on the Environmenstrual campaign. And we'd like to welcome and introduce our wonderful panelists, and thank you very much for taking the time to join us today and for sharing your knowledge, expertise and experience on this issue. I'd like to introduce Njoki Ngumi, Dr. Njoki Ngumi. She is a non-clinical general practitioner whose wider health knowledge and related expertise has been critical in the creative sector and connected arenas to enhance social economic equity and equality and advancement for all, especially for youth, women and marginalised peoples. And as lead researcher at the Venio Group, which is a boutique Africa-faced globally orientated strategic consultancy based in Nairobi in Kenya. She remains central in multi-sectorial public engagements, including high-level advisory, education and policy work, and stakeholder support and engagement, as well as network building and international dialogue. So thank you very much for taking some time, Njoki, to join us, and we're really lucky to have your expertise on this issue. I'd like to then introduce Assembly Member Linda B. Rosenthal, who represents the 67th New York State Assembly District, which includes the Upper West Side of Manhattan and parts of Hell's Kitchen. She's a lifelong resident of the Upper West Side and currently serves as chair of the Assembly Committee on Housing. But since taking office in 2006, Assembly Member Rosenthal has passed more than 150 laws that have helped to improve the lives of all New York State residents. And she's a leading advocate on menstrual equity, having passed laws to eliminate the sales tax on menstrual products in New York State, and requiring that free products be provided in New York State schools, in correctional facilities, and homeless shelters. So that's why she's with us today to discuss all these issues as well. In 2019, Assembly Member Rosenthal passed the first in the nation law requiring ingredient labeling on all menstrual product packaging. And I think this is probably first worldwide, really, that New York State is doing this. Again, why we'd like to hear more about it today. And we need to promote this kind of initiative worldwide. So kind of why we're here today really will be to discuss why we need a Menstrual Health Dignity and Sustainability Act, not only in the UK, but again in other countries as well, but taking inspiration from similar acts in Kenya, the New York State policy, the Free Menstrual Product Act in Scotland, and progressive legislation from Catalonia as well. We have prepared a draft act. Again, it's a work in progress, and we'll share that with you. Possibly we can share it in the chat so you can have a look at it. But it's going to be an ongoing process. But what we firmly believe is that if we can't talk openly about all aspects of menstruation, then we can't hope to address the health impacts. We can't hope to talk about the waste generated or how we can make menstruation more sustainable, but also crucially, how we can educate about safer, reusable and organic options available to all those who haven't started their periods yet even. And, you know, when it comes to regulation, do we know exactly what's in our period products? Currently in the UK, there is little or no regulation, or even worldwide, again, apart from New York State, there is some. There is no regulation which particularly sufficiently covers what's in our period products. So we have no way of knowing really. And that's why we need regulation like the New York State, like what's going to happen in Catalonia as well. And we also need a Menstrual Health Act or a strategy like Kenya to cover all aspects of menstruation. Just a note, today we'll be discussing periods, period products, science and research in relation to women, girls and those who menstruate. And we aim to use inclusive language such as women, girls and people who menstruate. But when we refer to research carried out exclusively on women or girls, then we'll reference it as such. So we're not making any assumptions about others who menstruate, and we also acknowledge the gaps in research to facilitate greater understanding of how menstruation impacts members of the LGBTQ+, trans and gender non-conforming and non-binary communities. So with that, we're going to start the session. Again, please put your questions in the Q&A. And I'll start, Njoki, with you. And if you could start by telling us a bit about what drove the Kenyan government to produce a menstrual hygiene management policy.
That's a really good question. And I'm also, I think it's in my conversations with you that I found that it's not a terribly common document in governments across the world. Kenya, it's important to say, is known for incredibly progressive policy documents, especially in the healthcare arena. We've been leaders in very many significant areas, including prevention of mother-to-child transmission of HIV and things like that. So we are really kind of on the money here with the current menstrual hygiene management policy. There's a couple of things that do need saying about this particular policy. It was intended to kind of harmonize and align several emerging conversations in different arenas. One of them, of course, was wider healthcare. The other one was women's human and reproductive health rights, of which menstrual health management and dignity is one of them. Menstrual health management also came up in the context of discussing achieving basic education progress indicators as well as school health indicators, so that young girls and adolescent girls are able to start and continue learning in enabling environments, as well as, of course, the right to work for folks who menstruate. We are also party to several international policies and have ratified documents that raise some of these issues as regards WASH issues. And we work continually towards achieving overarching sustainable development goals that are linked to this, as well as enhancing women's social inclusion. It bears mentioning that the menstrual hygiene management policy is available for download. You can literally just Google it and download it so that you can read the document for yourself. And the document itself kind of talks about the context of sanitation and hygiene to ensure equitable access to clean, safe, and equitable and adequate water, sanitation and hygiene for all, making sure that there's a clean and healthy environment for everybody, and particularly doing away with what is defined as open defecation, but then in the context of menstrual health, the kind of disposal of menstrual waste. There was a really good situational analysis that revealed significant gaps as regards menstruation that allowed for taboos and myths and stigma to thrive. And so the policy's intention is to establish enabling legal and regulatory environments for this, which also kind of say where the money to implement some of these things is going to come from. Breaking silence and providing everybody, including men and boys, with correct information about menstruation, health, and management, making sure that folks who menstruate have safe products, safe services, and safe facilities, ensuring that menstruation happens in safe and hygienic environments, of course, and then obviously ensuring that disposal of menstrual waste is done properly. The last thing I'll say about the Kenya policy documents is that they all of them have in common that they invite what they call like-minded stakeholders to take part in implementation of the policies. And so this means that folks are free to adopt the policies that they find listed out in these documents. Folks are free to call for reviews and edits. They're free to invite public engagement and participation. They're also free to critique and debate these documents and experiment with them and find, okay, this is what's working, this isn't working, and then call for changes to be made. And of course, the document opens the door for things like an act. That's not happened in our context yet, but the ideal would be that it does.
It feels like the Kenyan government should be in discussion with the UK government about this and how to do it properly. So we'll bear that in mind, definitely. It sounds amazing. And I suppose, Linda, maybe you could tell us a little bit about the innovative and I suppose groundbreaking Menstrual Right Act to Know for New York State, which specifically looks at what's in these period products, and what was in your involvement in getting the act passed?
Great. Well, thank you so much for having me, and it's a pleasure to be here with Dr. Ngumi and to discuss this most important topic. The way my involvement began was in 2016 when my staff and I were discussing the pink tax, which is women's products cost more, or products used by women cost more, and we looked up what is taxed in one of the handbooks. Turns out that period products were taxed, but items like fruit roll-ups were not taxed, and we were outraged. And so that began it lit a fire under us, and we decided we have to scan the whole industry and see what has for years been a backward attitude toward a biological function that if it didn't exist, none of us would exist, and to try to remove the taboo around a very natural process. So in 2016, I passed the law in New York State to remove the tax, which saves people who need these products money, but it also creates equity in terms of what we need to survive here. In fact, the first time I tried to pass it, I was told, well, the budget needs this extra money to go to different programs. I'm like, you are not balancing the budget on products that people who menstruate need. So the end of that. And so it just grew from there. I realized that public school students need products and many cannot afford them. So they are free in grades 6 through 12 in all bathrooms. You want to avoid the, shy raised hand, I have to go to the nurse. It should be available in bathrooms. And I periodically check with different schools to make sure that they really are available. And you have to keep checking because it's not always true across the board. The same for homeless shelters, which you'd think would be a no-brainer, but that's a very difficult topic anyway. And in prisons and jails, menstrual products are often used as manipulation tools. Like if you don't behave, you're not getting your products, and that's not acceptable. So all of that was leading up to what exactly is in the products that you put inside your body and in, most sensitive areas. And the fact that we were just buying them and using them without knowing that shows how, I wouldn't say brainwashed, but how accustomed we were to just accepting what was given to us. And so I set out to have an ingredient labeling law. Now, I worked with a lot of menstrual equity and environmental justice advocates to counter any opposition that was thrown our way. And which we did receive, and I can go into more later, but we succeeded. And now I check in drugstores, supermarkets, wherever those products are sold. I check to make sure they are all labeled, because I don't just like to pass a law. I have to make sure that people actually abide by it. And it's actually kind of fun.
Do you think that this has driven or will drive period product manufacturers to put this labeling outside New York State, outside?
Yeah, I think one of the problems that the manufacturers cite is like, well, then we have to create a special box just for New York State. And in fact, they tried to say, we'll just put a little pamphlet in the box. I said, no, you want to know before you buy it, not after you. As well as labeling on individual products that are available. For example, they have to be available in all state office buildings for free. And I saw that wasn't happening either. So I had them correct that. But if you label the products for New York, you might as well distribute them in New Jersey and Connecticut and it creates a new norm. And I have seen it spread to other states, even though they don't explicitly demand that those be sold labeled.
And I suppose this relates to your work, your campaigning work with My Always experience, Njoki. Can you tell us a bit about that for those who haven't heard about it? But
right. So one of the things that began happening quite organically in the Kenyan context was that several young women started having a conversation online tied to symptoms that they were experiencing while using certain kind of branded menstrual supplies, right? And it was one particular brand from one particular company that came up in that context. So one woman, Ms. Shifa Kore, was very instrumental in catalyzing that conversation and making it as wide as it became. And of course, Kenyan women who are very active online, and particularly on Twitter, the demographic of people who are on Twitter are very kind of publicly engaged, very publicly aware, super interested in having relevant conversations as regards their healthcare. And so when people started talking about experiencing itching, experiencing certain things with the kind of sanitary towels that we had from Always in Kenya, and that was different when they used Always from other countries, and quite specifically global north countries, everybody said, wait, this is true. And so folks came and started saying, oh, I thought it was just me. And so there was a lot of that kind of refrain echoing. And so we realized that people were having so much shame and experiencing so many symptoms around just a regular period. and
So
that this is
they're
a period.
blaming themselves for the reaction
Exactly.
rather, yeah.
This is the thing. And that also there's all this kind of the hierarchies of discomfort around a menstrual cycle and the experience of a period. And so there's folks who already are kind of dealing with a dysregulated period. So one where you're having things like endometriosis, adenomyosis, increased bleeding. So the kind of symptoms that would take you to a doctor already because you know that something's wrong with your body. But then the folks who didn't have that, but were experiencing itching, rashes in the general area when they use certain products and not other products, were feeling like this isn't that big a deal. Maybe it's just me. It's just a few days anyway. I'll just kind of soldier through. And so all of this was coming out in the conversation that folks were having. And so we realized when the conversation kind of blew beyond the borders of Kenya, as often happens when you're having a conversation online, right? That a bunch of other African countries, Ghanaian women, Nigerian women, women in South Africa, women in North Africa, women towards Central Africa, etc. So many people came and kind of crowdsourced all of this information. Our people who are in the global North countries were also buying the sanitary pads. They are opening them, showing that this feels different than this material. Folks who had both supplies in their houses were able to kind of do side-by-side comparisons. It was a wild time. When I tell you that folks just kind of having this critical mass moment when everybody was laser focused on this wild realization that we were being played so openly by some of these companies, right? That was really, really intense. And so everybody started talking about, okay, we've experienced it with this brand, but not with this other brand. There was the silencing of the hashtag that happened at that point, and we were very aware that suddenly the imprints on the hashtag had gone down, and we were like, obviously this is not happening from our side, because from our timelines we can see that more and more people are talking about this thing, and that it's even gone beyond Twitter. It's also happening both in open kind of social media platforms like Facebook and Instagram, and then even on closed groups. So people were screen grabbing this conversation, forwarding it into messaging platforms like WhatsApp, which are very closed kinds of networks, right? So eventually, a lot of things happened as a result of that conversation. But by and large, the biggest thing the biggest impact that it had on the Kenyan women, the ones who are privileged enough to be using these sanitary supplies, because like even as the honorable member mentioned, not everybody can afford these supplies. Not everybody has access to them, right? Even in a country like hers, which one would assume, right, everybody has access to these things. It's not true even there. So you can imagine in Kenya, of course, it's not true for everybody. So we discovered that even for the people who are buying some of these products, you're not necessarily assured of standard or high quality products for what you're paying, right? And so people realize that you have to be able to say these things loudly despite any pushback online. People are saying, oh, why are you talking about your period online? You should be talking about it just to your friends quietly. And nobody would have realized, if people hadn't had this conversation so loudly.
But I suppose two things that you could kind of realize with this. First of all, that they changed their ingredients as a result of this campaign. But the second thing that I kind of keeps niggling at me is that, with all this free period products and stuff being given out, and we talked to Linda a little bit about this yesterday, are we compromising on quality? Trying to address a period equity by giving these products? Are we giving products that may be cheaper made, contain more plastic or other harmful ingredients, and be creating some kind of health issues with these, when we should be aiming for safer, more sustainable, reusable, washable, organic products for all? So there's this kind of disconnect. I don't know what you think about that, and I can't think what the solution is, but
I think and this was evidenced by the pushback we got from some of the companies. They only wanted to list the ingredients that were, a certain percentage. So, for example, fragrance, they didn't want listed. Formaldehyde, for example, they didn't want listed. They said, oh, the amount in there is too small. And we wouldn't agree to that, because someone can be allergic to fragrance and they need to know that's in there. But by having to put the ingredients on the box, I think it caused more of them to want to put more acceptable ingredients. So you see organic a lot more. You see it even in store brands. It's organic, organic cotton. You don't have polyester and other fibers introduced into these products because they know that consumers are increasingly demanding more organic and more safe products. And so I think it's it's a spiral. You demand that, and that in turn causes better products. Of course, there will always be cheaper products and companies that skirt the rules, but that's part of the work to spread the message, to create awareness. And what the doctor said about the shame and the stigma is so alive still. It's kind of shameful. When I was a child, you put your product in your skirt and then shyly asked to go to the bathroom. You shouldn't have to do that. No girl should have to do that, or someone who menstruates. So by talking about it and by having webinars like this, it dissipates some of the shame and the stigma.
I wanna kind of riff off something that the honorable member said as regards the labels, and that's so important. I think for us, I don't know whether they changed the ingredients. They changed the packaging for sure. They one of the things that ended up happening was because that particular company had enjoyed quite a strong kind of monopoly over the market, and so everybody knew them as the brand to go to. And so once the trust in the idea of quality for their brand was broken, there was suddenly a large number of people who are much more open to exploring other brands, right? And so one of the things that we noticed happening for months and months and even years after, because it's been years since that particular online activation, is that that brand, the one that broke everybody's trust, they're always having to have sales now. There's always always 2 for 1. It's always, but then there's larger numbers of different kinds of other brands, smaller brands are coming up. People still have conversations online saying, there's this particular brand I'm looking for. Does anybody know where it's in stock? Folks come and say, okay, you want to check this particular branch of this supermarket, this branch of this supermarket. And that's going on till today. The thing that brand does in their enjoyment of their monopoly is that they were also the people who are providing for the supplies that were needing to go to schools. It was also that brand that was providing them because we raised that when we were kind of having this conversation online, and we were saying that, so if it's these guys who are providing those sanitary towels for young children, then what can we say if they won't give paying customers a sanitary towel that they can use in safety, and they won't admit to having been wrong, and they even co-opted the visuals of protest for their next ad campaign, where they were like, we've listened, we've learned, we've heard you, now we're all in the fight together, and everybody was really jaded by that, because it was a bit of an ugly move on their part to just kind of co-opt and kind of make that the protest was just kind of a surface cosmetic thing, when it was so serious for so many people.
Absolutely.
And so definitely those conversations are still going on about the quality of sanitary towels that are in the places where people are kind of getting them for free. And maybe the last thing I'll say is that I want to just kind of tie this to other conversations about do we take care of the body? Do we take care of the environment? And then isn't the lead arbiter the pocket at the end of the day, when we look at conversations even about things like unleaded fuel? And so currently the premium fuel, which burns slower, which is more effectively used, which causes less pollution, but which is by the gallon many more cents than what we call as our regular unleaded. And so people know that premium fuel probably burns better in the car, but then we'll all buy the cheaper one because that's what we can afford, right? And so at the point where we're having the conversation, we do have to realize that a moral imperative is to make the things that people can use for a better world more affordable. For as long as we call better quality fuel premium and market it according to the price right? And then people say, okay, I can't afford what's better. I'll just use what is, right? And so we really have to answer the question about, does it work for the pocket? That's also a moral question.
Sorry, you raised so many issues here, Sean, because they're really interesting. I mean, I just say that I found the My Always campaign really inspiring, because we've tried to do campaigns here and trying to raise transparency and talk about ingredients and stuff. And it just, well, apart from a little bit of engagement, there was no huge upsurge and and I think that does drive the period product manufacturers to change, just like the New York State Act did. And I think, like, one of the questions I was thinking about as well that you mentioned was this disconnect, what's good for the environment in terms of period product waste reduction and recycling, and what's good for health in relation to period products, for example, the less additives, less bleaching, the reusables and stuff. So, we keep getting told that this is good for the environment, but it may not be good for our health, and vice versa. And we need to kind of marry those two. Environmental health has to figure more. The how did the period product manufacturers come back to you, Linda, in terms of this act? How big a backlash was there when you were trying to get it passed?
I mean, they came up with many excuses. For example, that there wasn't room on the box to write the ingredients. And of course, there's room, all sorts of examples like that. And they said that, well, if a store is carrying something that doesn't have an ingredient label and it's been sitting there for a year, then, they should be able to continue selling them. And, at every turn, we said no. Because we knew this was the right thing to do. But something I am working on for next session, which begins in January, is to ban the use of toxic chemicals like lead, mercury, formaldehyde, PFAs in menstrual products, because they are still allowed, despite having to reveal the ingredients and their attempt to, they still use some of those dangerous chemicals, which are also bad for the environment as much as they are bad for the people who use them. PFAs are in kitchen and household products, in drinking water in some areas, and they accumulate in our bodies and wreak havoc on our health. But then they are also found in our waterways and in our, garbage. And so that's where I'm working with. There's one group, Clean and Healthy New York, which advocates for both the environment and health together, which is what you're talking about. And that's a movement that is catching on. And one other thing I hope the governor signs is the language that you use is really important. So right now in all of law, it's feminine hygiene product.
Right. Still.
So I have passed a bill that says they're called menstrual products. And that's not gendered. It's it doesn't have an opinion. It's just a straightforward. And I believe the governor will sign it. But everything needs to be changed. And one last thing is that there are many 11 and 12-year-old girls, and sometimes boys, who are taking the mantle. And I think that ultimately will create a change, because the younger people don't understand why it's a stigma. They don't understand why they have to be forced to use toxic products. They don't understand why they have to use inferior products. And so they are the ones, and perhaps they can be engaged in the UK more to spread the message, because they are future voters, which always impacts.
They are. I mean, we've been running sessions with teachers, mainly in Hertfordshire, a council in Hertfordshire we're working with, and Hertfordshire Waste Aware, which has been really great, actually, because we felt teachers may be the first or second point of contact, especially as we do have a period product scheme in the UK for free period products, although the budgets are quite small. Government, they need to be a lot bigger for schools, but they can buy reusables as well as single-use disposables. But then if the pupils aren't familiar with them, if they don't feel comfortable using them, if there's nobody to go to ask, how do I get this menstrual cup in? How do I get it out? If there are no clean toilets and so on and so forth, then people are less inclined to use them. So again, it's a big educational kind of curve, I suppose, really. And it's, I suppose it was one of the questions that I was thinking about, Njoki, about the water and sanitation issue is very different in Kenya to the UK. And from your experience, is it really viable for people to use reusables? And how popular are they in Kenya? Or
I mean, the thing to just kind of highlight as regards what the policy said is that it kind of went a little bit into the situational analysis that was undertaken. And it was a very revealing document. For instance, it said that out of kind of 12 million learners in both kind of primary and secondary school, about 5 million need menstrual health management intervention in schools. They talked about how in rural Kenya, 18% of schools had water in the taps near the toilet facilities, which tells you that 82% of schools, that's roughly 8 out of 10 schools, do not have water in the taps near the toilet facilities. The facilities themselves didn't always meet safety requirements, right? Such as cleanliness, because, and you'll find it's very common in our context that the children are doing the massive cleanliness of their own facilities themselves. And this kind of dates back even to colonial times. So there's a bunch of different things that have been carried forth since then. Some of them don't have lockable doors. Some of them don't have adequate lighting. Of course, privacy then becomes a concern.
sure.
Only 30% of schools availed sanitary towels for students. And this is in the context where there are government supplies, even though they don't get to everywhere and to everybody who needs them. But even in the context where there are supplies, only 30% of schools will avail them. And even those are given during emergencies. And so I'm reminded of what the honorable member said about not having to put up your hand and say that you need to go and visit the nurse. So all of these kids who are having to say that they need a supply have to kind of go and disclose that this is what they're going through, which of course kind of brings in questions about whether they're having a dignified experience. And of course, that's not a dignified experience because you go there and you never know whether the nurse is going to ask you, why couldn't you get them from home? Did you forget? You know, the ways in which people like to shame young people, right? And so all of this is revealed in this document. The other thing that kind of shows up is that very many households have to buy water because a lot of people don't have running water all the way to their home or even near their home. So you have to buy it, right? Which is also taking away from household income. And then you carry and ferry it from the place where you're buying it all the way home, which can be any number of any amount of distance. Sometimes if you're fetching the water for yourself, it can be fetched from kilometers away, right? So that limits the amount of water that's available within the household for any number of different things, including general hygiene, cooking, let alone menstrual health purposes, right? So for us, it's very much, where do you begin? Do you begin by making sure everybody has menstrual health? And then I think for me, the challenge is that it's kind of framed as an either or when it's a both and. We have to do both things at once. And then the questions we have to ask ourselves is, if there's money being allocated and it's not getting there, then where is it going, right? We have to do both things. We have to make sure that folks who menstruate have the menstrual health supplies that they need, that the environments in which they're menstruating are safe environments. One of the things that also, again, this menstrual management policy document raises is that a lot of girls cannot get the money that they need to buy some of these supplies from home, which then means that they can be coerced into relationships, especially sexual relationships with adult men, right? Which are, of course, violations, huge violations, because they are not at an age that can consent to some of these things, right? And even if they were, the economic coercion of the thing makes everything extremely muddy and problematic, right? And so we have girls in primary school, girls in secondary school having to be in these coercive, abusive relationships so that they can have the sanitary towels that will allow them to go to school.
So we
I'll
have to
never
pull
forget.
back right to the
Exactly. I'll never forget somebody.
source of the problem. Yeah.
There's an advocate I remember speaking to who talked about how when she went to a school in rural Kenya, they told her that they actually kind of negotiate around, if I get pregnant, right, then I'm not going to have a period, which means I'm not going to have to worry about
Sure,
getting
sure.
sanitary supplies.
Yeah.
Right. And
Yeah.
these are children who are having these conversations. And like, are these the things that children are supposed to be talking about, or are they supposed to be solving for X in
Yeah.
algebra?
Yeah.
Right.
Yeah.
So like it tells you about the kind of massive failures
Mm.
at national scale, at regional scale, on multiple levels that kind of lead us to this
Sure.
moment. And so the question, I think, is not whether we are ready to take on reusable. There's some people who are using reusables, but then it's how can we find ways to solve the problems that are making us not able to use reusable products at the level at which we can, and that extends beyond just the availability of the products and sending them to people and making sure people have the education that they need to use them. Also, the removal of stigma, right?
Sure. Sure.
Also making sure that places where people can, for instance, wash their hands after using some of these things, wash the
So that's
reusable
why we
sanitary
need
towel
this
itself.
act.
All of that
Yeah.
needs to be done at the same time.
Yeah. I mean, do you think, Linda, that that an act or strategy or plan like this encompassing all aspects of menstruation is a good way forward?
Well, yes, and first off, it's an opportunity for education because there's still so much ignorance around it. And certainly in some societies and in countries around the world, girls and women have to remove themselves from the household for a week, live elsewhere, not be in contact with others. And that also has to be highlighted because that contributes to women not having the same opportunities. You know, it's all of a piece. But I think that showing how broad the problem is and how there are solutions will be a successful strategy. But I was reminded, talking about reusables, that here we've had lawsuits that have been successful because some of the reusables have chemicals in them that are not healthy.
Yeah.
So the industry is always one step ahead of us.
Yes.
And so we have to be vigilant. But you know, starting from the beginning, you know, some of the path has already been worn. So what needs to happen? What are the best ways to get people involved? What is crucial? Like, there are lessons learned that can be used in other parts of the world, in the UK. But I think it is such a massive problem that I think presenting it and showing the breadth of it is a good way to get people excited and involved. You can be involved in the environmental end, you can be involved in the health end. You can be involved in the equity end. But what I always say to people to try to get them to understand is, when you go to a bathroom, any bathroom in New York State, you expect to find toilet paper. The same should be true for menstrual products. And then people kind of have a little light and say, wait, that is true. That is like the simple, basic, you don't expect chemically laden toilet paper. You expect okay quality, and the same needs to be true for menstrual products. But I think, you know, you have a job ahead of you because people would rather not think about this.
I know. But it is, I mean, menstruation is a human rights issue and a public health issue. And that came from Schaefer Okora, she did a blog for us around this. And ultimately, you know, it's 2023 and we're still, you know, talking about something that's been around since the dawn of time. You know, it should be a no-brainer. I suppose I just want to turn to some of the questions now, if I can. Somebody said, wow, amazing work in Kenya. Yep, absolutely. there is,
I'll say thank you on behalf of all the incredible people. This would never have gone as far as it had without everybody who just kind of pitched in across the board from multiple places.
I think, yeah, and I like I say, I think you don't get in different countries that doesn't happen, and unless that groundswell of public pressure happens, it's very easy to ignore a couple of NGOs calling for an act or whatever, you know, which is why we need this engagement. A question from Nisha: have you found that some period products are not sold in New York City because they have to label?
I'm not sure about that, but I do know that I mean, there are always cheap products, and perhaps they're sold you know, in bulk to different institutions, but eventually the marketplace evens things out because the consumers see and they say, I don't want to purchase this. So I think that was part of the intent of the labeling. You know, you can get on see the shelf and you compare products. If you can afford it, you're going to want to buy the one that has the least objectionable ingredients. And I think the market forces companies to do better.
There's a question about how can we persuade, I mean, because we're targeting this act at the devolved governments, health has devolved to Scotland, Wales, and Northern Ireland. The Welsh government has got a strategy on menstruation, which is quite good. But how can we persuade the government to initiate this act? I mean, really, does it start with the kind of public pressure to kind of initiate this? What do you think?
Yeah, definitely public pressure, but if there's a smart elected official or leader, they're going to see that, you know, they can actually make this change. And for those who aspire to great publicity and popularity, they can champion this issue. It doesn't have to be that way, but it is a byproduct when you stand up and you embrace something that's difficult and perhaps a little edgy, unfortunately.
I wanna agree with the honorable member. Oh, sorry. I didn't want to interrupt you. Yeah, I was just going to say that I agree with you. I think I don't think there's any one strategy, especially at this point in time. I think I'm a very both and all from all corners coming in kind of person as regards some of these conversations, especially because they're so overdue. Like we are long past talking about why we should be doing some of these things. We should be asking why haven't they been done already, right? And so I think if some governments, and you know, I think at this point in time, it's just good to be honest, some places they respond better to shame. So use that strategy. There's some places where folks respond best to being told, in competition with such and such a government, you're actually doing really badly. And so then they say, oh, we can't be seen in public to be doing as badly as X and Y and Z. You're doing the same as X and Y and Z. You should be doing better. And these are the easy ways in which you can do better. So I feel like folks should just kind of know what their own governments kind of respond to and then kind of play to that. And I think the other wider question, and I'm sure the honorable member will agree, is that the question that we're asking here is about how do we get people to be politically involved for long periods of time, especially at a time when there's so much jadedness around political involvement for anything, whether it's electing somebody that you like, whether it's making an issue that you care about, get a larger platform, be talked about at a wider level. How do you do that organically and sustainably among a people who are already so exhausted, so tired of doing survival work? And I think that's a wider question beyond just kind of our focus of today, which is menstrual health management, but it's a question that's being asked around political involvement everywhere. And so when we start having the conversation as a public that political involvement is not just kind of showing up, casting your vote, getting somebody into office, and then doing it all again in the next 4 or 5 years or whatever, but it's about making sure that all of the things that they said when they were talking so nicely to get your vote, that they have to get them done. And if they're not getting those things done, they need to be aware that you can get rid of them in the middle of their term, right? And so what would that entail? and what does getting the public to understand that they have that kind of power entail? That's really the baseline. Because at that point in time, you can then make people realize, oh, we have the political power to do X and Y and Z, then it means that on the issues that we care about, we can be heard and we can be louder, and that people will care and they'll have to care because our taxes are paying them to care.
Sure,
you know?
Sure. And that's true for any issue, for every issue. But what's interesting to me is why it hasn't risen to that level. Is it because there are too many issues out there? Is it because there are not enough inspired elected officials or leaders who say this is an important thing, if only to get elected? You know, obviously take up causes that they think constituents will like. But, you know, this is something every woman should be looking into.
But this isn't why you did it, was it, Linda? I mean, you had a passion for these issues. You know, it's not.
And you can really kind of see what the cost of the taboos and the myths and the stigma is. It's that folks don't feel like they can take up some of these issues. Folks don't feel like they can talk about some of them. If for years, ever since you were young, the whole conversation around menstruation has been silence, silence, silence. You can't even talk to your doctor about it. I was in medical school and I wasn't aware that the problem was not me, it was a part because I was using these pads that were creating problems and I had the problems. And it hadn't gotten into my head to, because the only question we ask about sanitary towels when you're finding out like a gynecological history is, how heavy is your period? How many pads are you using a day? Right? Nobody then talks about how is this pad making you feel? It's like, I use 3 pads a day. Are the symptoms bad? Everybody's aware that, you know, you might have cramps, you might have a little bit of diarrhea. That's par for the course. And then we only talk about it if it's extreme. Right. But
if they haven't been using real blood to test period products up to now, then when you go to the doctor and say my periods are heavy, it's kind of immaterial because we've no way of knowing that this has been the case.
And that even like there are folks who even like, I have a friend who has to use adult diapers because her flow is so heavy. Right. And so like, if you ask her, like, how many of whatever you're using are you using? And she tells you 3, she's not telling you the same 3 as somebody who's using, you know, a different supply, right? So there's all of those kinds of things to consider.
Sorry, we're getting lots of questions. I just wanted to say, Linda, can you kind of replicate yourself? Because we really need more legislators like you, like
maybe I'll just move over there.
Do come over here.
But you know, I believe we also have to look at it through, this is a women's issue. And for years, men have dominated the political scene. I have no doubt that if women hadn't dominated, this issue would have been solved a long time ago. And so this goes along with more and more women taking office, having leadership roles. I mean, the United States, we've never even had a woman president, so we're behind in a lot of ways. But you know, there's often the use of a celebrity, and celebrities naturally get all this attention, and that could open the dam if you have someone who's willing to be out there and outspoken and just create an environment where you can openly speak about these issues.
A storm. I think
you need a star.
Yes. I suppose, I mean, we talk about how women can get into positions of power. But, you know, in terms of how this relates as well to, you were talking about a pupil coming up and asking for a period product. I mean, if you were kind of trans or non-binary or, you know, how much more difficult might that be, you know? And again, we try and think about including all those who menstruate, including women who don't menstruate as well.
Well, the transgender issue is volatile, and you know, I'm a Democrat, and we've experienced when we pass laws that the other side loves to talk about the bathroom. That's all they like to talk about, and they've made it a despicable conversation. So it's even harder to get through. But that's why the law I passed is all bathrooms, 6th through 12th.
Sure. Yes.
But it's not true everywhere. Yeah.
there's a question. There's lots of questions actually, which is great. Does using toxic products from a young age affect a cycle in the long term? So again, how can we make schools in particular sexual reproduction health classes more engaging?
Mm.
So
I really like that question. It's actually two questions also because it kind of ties into another question that somebody asked, which is from Rachel, which is, what role do you think menstrual cycle research plays in the issues mentioned?
yes,
I think the thing to say about menstrual cycle research or menstrual research in general is that, of course, it's been extremely underfunded. Nobody's thought it's worth doing much about anyway. There's very much that we don't know about what one would ideally say the normal range menstrual cycle, let alone all of the challenges that can be faced when different things in the cycle go wrong, right? And so I think we don't know what the effects of using some of these products from a young age can be in the long term, simply because no research has been done to just kind of follow that up, to check in, to see are there effects of using a certain kind of product. People expect women to just be grateful that they have access to a product, right? Beyond even asking, like, is the product doing well for you? Do you find that when you use this product versus this other product, you feel better, or, things like that? And so currently what we have is, marketing, it's labels, it's a company kind of framing themselves as organic and riding on the marketing work that so many other people have done around the word organic to kind of enter into our heads with subliminal associations that organic equals good for you, right? That may not necessarily be the case, as the honorable member mentioned, as regards some products that were saying they were organic, but when push came to shove, they were not.
They were not,
I mean, I think I love this question about how we can make school sexual, reproductive, and health classes more engaging. I think one of the fights that's being fought now is that there's a whole bunch of people who do not want schools to even have sexual reproduction and health classes to begin with already. So I think the first thing is to fight that they stay, right?
Yes.
And then as regards engagement, I think the thing is to have both a responsive curriculum as well as to foundationally make it that you're responding to what the young people want to know, because young people now are very different than young people when we were, the age that's in middle school, or the age that's in primary school, or the age that's in high school. Because of the ways that information goes around the world, they know different things, they're curious about different things, they're pushing back against certain things that they've had, they have their own kind of developing myths and taboos that we have to keep kind of responding to in a way that's open, caring, non-judgmental. Understandings of gender, for instance, have exploded in the last 2 decades in ways that they were not in the decades prior, right? And so when we're now having sex education, is our sex education gender aware? Is it gender responsive in ways that include rather than push out different people, right? So the ways in which it can be more engaging is directly responding to them, as well as also kind of making sure that they remain, because in the current regime, and this is global, there's a lot of pushback to make sure that teachers can't give students certain kinds of information, students can't read certain kinds of books, certain books can't be found in certain libraries, some things are supposed to be for parents only to teach, but then the parents are the same ones who are also seeing that they're overwhelmed, and why isn't the rest of society helping them?
And affected by the taboos as well. And
Exactly.
Here in the United States, where the Supreme Court ruled that abortion, there's no right to an abortion, is really it's so chilling. And states are banning access to any kind of reproductive health care. And so New York, we pride ourselves on being a beacon. But sadly, as the talk around not allowing women, even those who could die or who were raped, not to have access, it will tamp down any discussion of anything having to do with women's reproductive functions. And it's very scary and it's very dangerous.
And that the other thing to realize, especially in these political times, is that once certain things have been banned, it never stops there. There'll always be the banning of the next thing and the next thing.
Yeah.
So
Yeah.
they'll definitely be coming for access to contraception, for sure.
Yes. Oh, they
Yeah.
are. They are.
Yeah.
They are.
Exactly.
So the
So
like
so it's also
campaigning and the
being,
fight is never done, really, is
it's
it?
never
It's like
done.
the
And it can be,
backlash. Yeah.
and it can be such an exhausting thought, right? That
Yes.
you can't sleep on the job. But then even the reason that we are here where we are, the reason that we are women who do certain kinds of work in society, is because there's generations before us that didn't sleep, you know. So we owe it to them, we owe it to those who are coming after, to make sure that on the things that we can hold on to and push forward, we can do that at the very least.
Maybe as a small sign of hope, maybe there's such a strong backlash, is that we have been so successful in gaining so much. But yes, it's disappointing that we still have to struggle, but also, I suppose, nurture a new generation of feminists, really, to carry forward with the fight, sadly.
Absolutely.
I just want to say that we're coming up to 2 minutes, and it's really flown, and it's been really, really engaging. So much so that we haven't had a chance to answer all the questions, but maybe we can follow up with an email to the answers to the questions that we haven't been able to address. So I just kind of want to end just with a word from both of you, just because we are looking at this act, and in terms of kind of what your thoughts and hopes are, really, for that work, and where we can draw inspiration and strength from. Do you want to start, Linda?
Sure. Well, it's really been a pleasure speaking across 3 countries, the commonality and the fact that in Kenya so much has been done, in the United States you can find hope and inspiration, because there are concerned people everywhere who want to advance menstrual equity, environmental, saving the environment, literally. And good people joining hands can get this accomplished. And I'm always at your disposal if you need anything to help push it
Brilliant.
forward.
We might hold you to that, actually. Definitely.
I mean, the thing I would say is actually in response to a question that's been asked by the Sile Immaculate, who talks about how some people are being given reusables, but then they don't necessarily have access to running water. And I think the general point of analysis that I draw from that is the fact that we have to respond to the people. Anything, if you want to kind of get the people's support and backing, has to be in response to what they are raising as the problems they have. And so it's the public who do have to get involved. And I think asking the public questions and then telling them, these are the answers that you gave. All of you said that you hate this particular brand. All of you said that you hate when sanitary towels or menstrual supplies look like this or like that. All of you said that you encountered stigma in these particular places, but then not in these places. So these are the places that we're going to learn from. So I think starting from where the people are, even if it's not where we feel we are or where we would want to be, starting from where the people are, I think, is immediately where we should be. Because like Sile puts it really well, that why would you give folks supplies that need you to have running water when they don't have running water? Right? That doesn't make any sense. And she's right when she says that.
So it is about dignity, it's about health, it's about sustainability, and we need to address all these.
Yes, and that the dignity begins by responding to what the people say they want. It starts there, that you dignify them by responding to them as though their needs are valid, because they are. Sure,
definitely. And yeah, it's about public engagement and engagement of people in terms of when we are defining policy. I'm going to stop it there, and thank you so much. It's been an absolute pleasure, and I wish you both well with your future work. And thank you for being such an inspiration to us all. And thank you very much for your participation today. We really appreciate. We will follow up with an email to the participants and try and address the questions they've asked that we haven't been able to get to. But thank you all for joining as well. It's been an absolute pleasure, and yeah, we hope to carry on this discussion in future. Thank you.
Absolutely. Thank you all and have a lovely day.
You too. Bye.
Bye.
Bye.